Hello and welcome to India Fights Back. I'm your host Rajat Kain. Well, a set of comprehensive guidelines has been issued by the government for the management of COVID-19 in children. In these guidelines, Remdesivir, drug that has often been among discussion in terms of the treatment protocol of COVID-19, has not been, I emphasize, recommended for usage for children. However, for rational use, HRCT, that is CT scan, has been suggested. Use of steroid in treating asymptomatic and mild cases of infection is termed harmful, and they can only be recommended under strict supervision for hospitalized and moderately severe or critically ill COVID-19 cases. And with children, it has to be administered, possibly if required, under strict supervision of doctor. At the same time, we talk of the COVID appropriate behavior. Children above 12 years of age or 12 has been asked to wear mask in a similar conditions that adult keep wearing. They've been advised to follow COVID appropriate behavior of wearing face masks, maintaining social distancing, and of course at the same time to keep washing your hands and maintaining hygiene. Well, this is a very important issue, and to discuss this further, we are joined with Dr. Shobhna Gupta. She is Chief Medical Officer, Department of Pediatric, Safdarjung Hospital. Many thanks, Dr. Shobhna Gupta, for joining us, and Dr. D.K. Gupta, Chairman, Felix Hospital, Noida, and Senior Pediatrician. Ma'am, let me start with you, Dr. Shobhna Gupta. How important do you think these guidelines are for COVID-19 cases in terms of managing illness of this virus amid children?
Yeah, thank you, Rajat, for giving me this opportunity to share the guidelines. As you rightly said, that we had many children in this wave which were infected with COVID, and there is assumption that in the third wave probably more children might be affected. So these guidelines from the government of India were very, very essential to clear out the myths, as well as to have only the important things, to resources utilized only for the important cases, and also to remove the panic and that anxiety among the parents that they should not go for each and everything. So as we come to the guidelines, these guidelines actually have divided the children into depending on the severity of the disease in the children. So we can divide them into asymptomatic, mild cases, moderate, and severe cases. So as far as the parents are concerned, they should know how to know that whether their child is under mild or whether it is or he requires a hospitalization. That is from the parent's perspective. So in the asymptomatic cases, like most of the children will be asymptomatic, then why we are treating them? Basically, they might be the contacts of the COVID positive patients in the house, and the other members may be COVID positive, and the child may be totally asymptomatic. So he might have been tested as a contact of a parent, or he might be a suspect case. So in that case, being asymptomatic child maybe totally did not have any symptom. So that child do not require any investigation apart from the if he has been tested for the diagnosis, but he does not require any as such blood investigations or CT scan, first thing. Secondly, about the medicines, since the child is not showing any symptoms, what a parent need to do is only mainly to maintain the hydration of the child. That's important, that he is taking liquids adequately and passing urine. And secondly, to have a good nutritious home-based diet. These are the two most important things. And definitely to monitor the temperature and the saturation, but that too 4 to 6 hourly. It's not required to measure every half an hour, 1 hourly and get panic, because if the child is moving, playing, his heart rate might rise a little. So that's the only 3 things required. Apart from that, no reason to panic the parents as such. But they must be aware of what are the danger signs. So that I think we would be talking about when we are going. So they should be knowing. In the mild cases, the other spectrum is mild cases where the child may present to you with a low-grade fever up till 100, 100.5, mild nasal discharge, cough, and sometimes mild, diarrhea, loose motions. So these are the normal symptoms which normally also happens in the children when there is a upper respiratory tract infection like flu and all those things. So what they need to see that the saturation is above 94% in those cases. One important thing here in these both of these cases is especially when the children are more than 12 years, that we can monitor them for the symptoms, and there is a test that is a walk test, 6-minute
Yes.
walk test. This test was very much talked about recently for adults, but now the guidelines have come to do it for children as well. But this test can be done in more than 12 years of age group because they are, they understand the situation. So it's a very simple test to do. They simply apply a pulse ox in the finger, see the saturation, and then the child can walk within the house for a 6 minute, the normal walking, brisk walking within the house premises, and again the saturation is taken. So
Right.
if there is any drop in the saturation of more than 3 to 5%, then only it has to be reported to the doctor. Normally it remains the same or even increase with activity. So then otherwise, so this is just for monitoring, which can be done 12 hourly twice a day. Apart from that, temperature, and again the same things, the hydration, nutritious food, and paracetamol if the fever is more than 100. So
Right.
these are the important things. No antibiotics to be given to
Okay.
children of asymptomatic and mild cases. No blood test without doctor advice. No CT scan. So these are the important points which have been highlighted in these conditions. And definitely, if the child goes on to a little more symptoms, then the child requires hospitalization. So in those symptoms, if the child is having a high grade fever, along with that there is a problem in the breathing, shortness of breath is noted, then definitely, and there is a drop in the saturation less than 94, 95%. On 6-minute walk test, the child there is a drop in saturation, then definitely the child needs to be shown to a doctor, preferably hospitalized. So basically,
Right.
your pediatrician advice should be taken in those cases.
Right. Many thanks, Dr. Shobhna Gupta, for your opening remarks. It's really important for all of us who are watching our show, and of course, like who have children at home, to please keep listening to experts. Here we have in this program two experts who are just elucidating in this extremely important aspect of how to maintain, COVID-appropriate behavior, and at the same time, the management of the entire COVID mechanism when a child is down with COVID. I mean, if there is any child down with COVID. We're also joined with Dr. D.K. Gupta. He's pediatrician from Felix Hospital. Sir, many thanks to be with us. Sir, we often get to hear about, third wave, and there is a hypothesis that possibly children could be affected with the third wave. What is the basis usually is of such hypothesis that a certain age group could be at risk when it comes to talking about a particular wave or B particular wave? Sir.
That's a great question, I think, and it is currently quite popular right now in media, Mr. Rajat, and I am thank you for asking this question. I will tell you that during first wave there was most of the patient was from older age group. Mostly they were plus with comorbidities. And during the second wave, we had patients from middle age group, even younger age group, and rest of the patient was from the older age group, that is 60 plus of comorbidities. There is one hypothesis that in first wave, the COVID attacked comorbid patient, older age patients, and second, it involved the middle age and younger age population also, and most probably in third wave, it will involve children, and it will more involve children. Second hypothesis is that we have started vaccination program. This is one of the largest vaccination program we are doing in India, and we have inoculated around 25 CR population till now, and more probably till December we will inoculate around 100 crore population as per government of India's plan and vision, and they are to have around 200 crore plus doses during this next 6 months also. So most probably they thought that if we inoculate most of the adult and older population, that will be only vulnerable population will be children. That they will be high risk. That will be the virgin population. That will be a susceptible population who can acquire COVID infection if it exists in the society. These are the two hypotheses. Based on that, we are saying that more the children will be affected during third wave, but it is not actually true. It is just a hype. It can be there, but as per WHO guidelines, as per expert, as per Indian Academy of Pediatrics reports, as per CDC guidelines, most probably children will be affected at the same rate or maybe at a little higher rate. We have seen the infection rate is common or same in all age groups, be it pregnant lady, be it male, female, older age group, younger age group. Infection rate is same, spread rate is same. That it did not different. But however, complication rate, death rate, severity of disease can vary in different age group, different population, even sex. It means children generally less than 10 years of age, they have very mild illness and they do not require hospitalization. 92%, 93% children do not require hospital. Less than 10% children require hospitalization. Out of this 10%, only 1 to 2% require ICU intensive care unit. So therefore, we should not be worried about the children, but definitely we should prepare our hospitals, our clinics, our hospitals to have any such episode that we have serious or severe disease in children, then we should manage them at the nursing home, hospitals, or intensive care units. So that is the only thing I think.
Right. That's really important, Dr. D. Gupta, and thanks for highlighting it. That of course we require, apparatus, right apparatus and infrastructure in hand so as to counter any possibility of a third wave that has been often talked about, and of course, like the risk that it poses to every age group, in particular children. Dr. Shobhna Gupta, just carrying forward this discussion upon how COVID possibly attacks children. So here, ma'am, what are the signs one should look at? Like this, possible hints that possibly your child require immediate test or at least some investigation of sorts so as to find if there is a COVID-19 positive case or not?
Yeah, as I discussed in the last question also, see there are two scenarios. So if the child is asymptomatic or mildly symptomatic, why should we seek further testing? If one of the parent or some contact is strongly positive within the household. So that is one scenario. Second scenario, apart from that, there are two other scenarios. If the child is sick, so second condition, the child is already known COVID positive. And now the child has shown us with the severe symptoms. So what are the severe symptoms? And thirdly, there is another entity which is called as the multisystem inflammatory syndrome or the MIS-C in children, which can occur in a child who has recovered from the acute COVID, but it can occur 2 to 6 weeks after the acute infection. So both the things are to be taken care of more seriously. The signs of both of them are important. So first we'll come to the moderate and the severe COVID. The child can present to you with a high grade fever. So if a fever is going high grade, even till 104 fever is documented, that too more than 3 days. Even after 72 hours, similar high grade fever is persisting. Along with that, there is a cough, which is more than out of proportion. Child is lethargic. There is a decrease in activity, and the child, if you see in small children, normally at home there is not possible to take the blood pressure, but the child, you will see that the child is feeling exhausted and lethargic. So there is a tiredness, extreme tiredness, that shows that the child's heart might be involved and he might be having a system involvement. So apart from that, any vomiting, pain, abdomen pain, the loose motions, rash in the body. So these, and even sometimes a severe headache, and in very severe cases, sometimes 1% there could be even seizures. So in these cases, the child needs to be hospitalized immediately. Secondly, I would say in the MIS-C which I was talking about, here the child will give a history, the parents will give a history that someone in the family was positive either 1 month back, 1.5 months back, or the child was positive. So every time we might not get the history of child being positive, the child will present with fever. Along with that, there is very typical rash, or there are red eyes, which we call as non-purulent conjunctivitis. So child will present with you red eyes. So rash, red eyes, tiredness, some weird symptoms like diarrhea. So multi-system, there are many symptoms which are not fitting into one thing. In those cases, the parents should consult a doctor. Why? Because there could be involvement of the heart in the MIS-C. So in that case, it's a very urgent condition for which the timing is very important. The child needs treatment and hospitalization within 12 to 24 hours. Otherwise, if the heart goes, there could be a very dangerous condition. So
Right.
the parents need to be aware of the danger signs, that when we need to be hospitalized, and they should not delay the at least the supervision by a pediatrician, a specialist. So that's the important thing.
Right, right, right. Dr. Gupta, when we talk of the treatment protocol for COVID-19, there has been, of course, revisions of late. What initially were prescribed or accepted as, say, general medication for COVID-19 has now been changed or now been junked. And one of those important component of protocol was use of steroids. So now, where do we stand in terms of usage of steroids? I know in the advisory or guidelines published by the Government of India, the use of steroids has been extremely restricted and strictly under the provision or to say supervision of the doctor. So how important is therefore to treat COVID patients and when steroids are usually required?
Great question. I think as Dr. Shobhna has explained that asymptomatic and mild cases do not require much treatment. They require only paracetamol if the patient has fever or child has fever, and simple diet and plenty of fluid that is required, and rest of it. And we have to monitor the signs and symptoms for any danger signs. Second, there is a moderate disease and severe disease. In case of moderate disease, when respiratory rate is more than 60 in case of less than 2 months of age, and 1 year to 12 months, respiratory rate should be more than 50, and between 1 year to 5 year respiratory rate should be more than 40, and with more than 5 years, if it is more than 30, then it shows that there is sign of respiratory distress and patient is having pneumonia and oxygen saturation is between 90 to 95%. Then this case is labeled as moderate COVID case.
Okay.
And this case, we have to give paracetamol, basic supportive treatment, and antibiotic is required if we have evidence or suspect that patient can have bacterial infection. Corticosteroid may be administered in rapidly progressing disease. If deteriorating fast, child is deteriorating fast, then we can think that he is having rapid fast disease. Then in this case of we can use steroid that can be dexamethasone or methylprednisolone in moderate disease also. And if child is having comorbidities like patient is suffering from congenital heart disease or chronic lung disease or juvenile diabetes mellitus or maybe other sickle cell anemia, blood cancer, something like that, then we have to think and we can use judiciously steroid in moderate disease also. If child is having severe disease, means child having acute respiratory distress syndrome or having pneumonia on CT or X-ray, having multi-organ dysfunction or pneumonia with cyanosis, these children may present with grunting, severe retraction of chest wall, lethargy, sometimes seizures, unconsciousness, difficulty to arouse. These children require HD or ICU care, and these children require IV therapy, and corticosteroid is given in these category of patient without any contraindication. That is dexamethasone 0.15 milligram per kg per dose, maximum to 6 kg twice a day, and equivalent dose of methylprednisolone can be given 5 to 14 days of illness based on continuous clinical assessment. Antiviral drugs are contraindicated. However, we have not having any study in children for Remdesivir also. More than 18 years of patient has been given a study on the Remdesivir, and that has not shown any death benefits or any mortality rate benefit, any survival benefit. That's why it is not indicated. But if child is having onset of symptoms within 72 hours, and the disease is progressing very fast, then definitely we can use Remdesivir in children, those who are more than 12 years of age or weight more than 40 kg. In these children, we can think of using of, but it is not proven that it will be beneficial or not. Therefore, Remdesivir is contraindicated in current guidelines for children, except by doctors' judicious use depending upon the patient condition, and it should be given before within 72 hours of onset of the illness. However, the steroids are also given there, as doctor told, in multi-system inflammatory syndrome in children. MISC that occurs 2 weeks after and it presents with the rashes or bilateral non-purulent conjunctivitis, hypotension or shock, sometimes myocardial dysfunction, pericarditis, valvulitis, and evidence of coagulopathy means there will be raised PT and APTT markers in the blood test. Patient can present acute gastrointestinal symptoms like diarrhea, vomiting, or pain abdomen. There can be elevated markers or inflammation such as D-dimer, C-reactive protein, procalcitonin, ESR. And in these cases, we can use methylprednisolone. Steroid can be used 1 to 2 milligram per kg per day. And in these cases, we can also use intravenous immunoglobulin 2 gram per kg over 24 to 40 hours. Even in these cases, we have used broad spectrum antibiotics also. And these patients should be admitted in intensive care under close supervision of pediatric intensivist. And also these children should be screened for ECG, ECO 24 hourly to rule out any cardiac involvement also.
Right. So these are important things that our experts are highlighting here. Dr. Shobhna Gupta, as we have seen in the second wave, which has been extremely catastrophic, besides COVID, or say after recovery of COVID, there has been other complication among the survivors and the ones who have recovered. Any such caveat that you would like to raise here at this stage, especially concerning children? What is that one should look out if unfortunately somebody's child is, diagnosed with COVID and thankfully has also recovered from COVID? But post that, what are certain things one should be wary about?
Yes. As you pointed out about the post-COVID complications, so one of the post-complication we have just talked about is MIS-C. Actually, MIS-C is also a post-COVID complication in children. So that is a hyperinflammatory state, which we have already discussed. Apart from that, what we have seen in adults is like, it's very talked about is, the mucormycosis, which has been, the cases have been coming in adults. But fortunately, till now, we have not encountered any case in child till now. But yes, definitely, we should know what we have to be aware of. Basically the important pointers towards that is to keep the nasal hygiene. So if any child, especially the older children, they still can have. So what the parents need to know that if there is any pain in the nose, in the eye area, there is eye puffiness, or there is some crusting in the nose, some blackish discharge from the nose, or any numbness. There is a numbness on the one side of the face, or there is some particular recurrent tooth pain on the one side of the body. So, and there is eye pain which is not explained by any other thing or swelling. So, in those things, normally, what used to happen, that people used to ignore that it will happen. So, because these things are very fast progressing nowadays, if taken care on time, and especially in what are the high risk group, this mucormycosis is not happening in every healthy individual. If there is a history of hospitalization requiring prolonged steroids, and especially with the patients with the comorbidities, suppose a diabetes mellitus patient who has been given steroids for long, so they get prone to get the fungal infection as such also. Because see, what is fungus? Fungus lies in the air, dust air. So if it is also in our environment. But if a person's immunity is low, he tends to acquire that fungal infection and he inhales it, and it goes and produces the symptoms. So if the child or the patient is on long-term steroids, is having is diabetes, or is immunocompromised, is on long-term steroids for any other disease, suppose the cancer patients, so these patients are more prone to get the fungal infection, and they might present with this type of presentation, that the eye or the ear pain, nose pain, crusting, some blackish discharge, or even the pneumonia. Sometimes the patient recovers and again he has fever after 1 month, or again recurring cough. So and with the sputum discharge, so the HIV patients, so immunocompromised patients, they become more prone to it, and we should be aware of the symptoms and to seek the medical attention as early as possible, because it requires a definite IV antifungal therapy and the surgical resection also if it increases. So we need to be aware that these symptoms should not be taken lightly, and but no need to panic. Nowadays everyone is getting panic also. Ki mucor ho gaya. So it does not happen to a healthy individual. If you are already recovered 1 month, 2 months, you are feeling fine, then why it will happen? It will not happen like this. So there are some baseline parameters there, but
Absolutely.
simultaneously no need to panic and cause panic attacks. So that's also important.
That's really important, and many thanks for explaining this threadbare, ma'am, regarding, say, the post-COVID symptoms, or to say post-COVID recovery issues that a lot of people are facing rather in this second wave. Just a last question here. I just have a minute or two to squeeze in here. Dr. D.K. Gupta, sir, just very, very briefly, sir, any caveat for parents given, like, children are usually very active and they would tend to spend a lot of time in activities, playing outside homes, or, interacting with other children. So any caveat for parents? I mean, what should they take into consideration or take care especially?
Currently, definitely, parents should check that children should not go outside and should not play unsupervised in these parts, because if they are post-COVID patient or children are having COVID in recent past, they can acquire infection, that, as Dr. Shobhna told. Outdoor activities should be restricted only to healthy and non-COVID or non-COVID patients, those who can go, and it should be also supervised. And all parents should implement infection control SOPs in their house, that if they are going outside, they should wear proper mask. If the child is more years of age and they are coming inside, proper hand hygiene, proper respiratory hygiene should be followed in the house. And also they should not, if they are going outside also, they should not go to crowded places, I think, and they should wait for the vaccine. I think we should have a happy news within 2 weeks that JIDES is applying for the emergency authorization vaccine for the children between 12 to 18 years of age, and there are vaccine trials they have started from 0 to 2 to 18 years of age also by the vaccine. So most probably within a couple of months we will have a good news for 12 to 18 years of age, and maybe after 5-6 months all children will have a good vaccine, and after that they can go to school, they can go to parks, everywhere they can enjoy that. Thank you.
Just want to add one line.
Yes, ma'am. Please, ma'am. Go ahead. Go ahead, ma'am.
That while using the mask, what is happening? Please, parents need to know that they should wash the mask. If they are using the cloth mask, that should be washed regularly, and they should avoid touching the mask with the bare hands, because many times they just remove the mask, keep it anywhere, drink water, again apply it. So they should sanitize their hands or wash their hands before using the mask, and that mask should be replaced regularly. That mask should not be used for weeks altogether, the same mask, because again there will be colonization of organism in that mask, and that can also cause infection. So hygiene, the mask is also important, which is
absolutely. So clearly personal hygiene is important. All precautions what experts are saying are important, and at the same time, be it adult, be it senior citizen or children, COVID appropriate behavior is extremely essential. What is that? Keep wearing face mask, keep washing your hands, and of course, do not forget to maintain social distance. Many thanks, Dr. Shobhna Gupta, for joining us. Many thanks, Dr. D.K. Gupta, for joining us and talking on this extremely important aspect. Well, that's it in this edition of India Fights Back. Thank you. Goodbye.